And the things it can cover are right there on your screen. You can see a lot of tablets, a lot of needles, and some white powder injections and a spoon. Those among you who have seen Breaking Bad, they can relate to a lot of this kind of stuff. I hope nothing more than that. But in today's presentation, I will give you something that is related to everyone, not only pharmacists, but even ordinary people, not, even laymen. So today I could have talked. I could start talking about heroin and marijuana and opium and fentanyl and oxycodone. These kind of medications, but I will be focusing on the most common form of drug abuse that is not even considered an abuse by ordinary people, and sometimes even pharmacy students or even medical students. Those types of drug abuse involve prescription drug abuse and the drug abuse with the OTC medicine, over the counter medicine. So I'm going to start my presentation in a different way. First of all, I'm going to acknowledge the people who have helped me in making this presentation. So I was helped by a whole list of pharmacists who gave me their personal anecdotes, because these pharmacists, they are in the market. They are actually performing their duties either as community pharmacists or as hospital pharmacists, not only in Pakistan, but even in Gulf countries. So I asked them, give me your stories. What is the most common form of drug abuse that you encounter, especially prescription medicine and non-prescription medicine? So most of the things that I'm going to show you, they are in the Pakistani context. So Miss Aisha and Kashif Ali, they provided me with the information that is related to Karachi and Sindh, right? Both from the hospital, in the hospital context, as well as in the context of community pharmacy. Abdul Mughis provided me with the information that was applicable in Islamabad and most of Punjab. Same goes with Mazhar Malik, Tariq Khalil, Shehzad, Amjad Ali, Salahuddin Qamar. And then some other people also helped me in informing me about Pakistani context. And also bibliography, I got most of my information from drugabuse.gov. This is the setup in the United States. So in short, this presentation will cover both Pakistani context, and there will be a lot of information that is applicable to the entire earth. Okay? So if you have any questions, you can keep writing them, and then I will be able to answer them. And as far as this forum and its presentation was concerned, I can go bilingual, both English and Urdu context, right? So let's start. I'm going to start with my disclaimer. My disclaimer is that this is an educational session and I won't be using much of jargon. There is enough professional material available for professionals who can look it up at drugabuse.gov, right? And there are a lot of details available. Since this session is primarily for pharmacy students ranging from first year to third year, fourth year, fifth year, and also, of course, professionals are most welcome to join the session. But I am going to be focusing on a very foundational level, very basic level, right? And second disclaimer is no commercialization, marketing, or branding is intended in this presentation. Although I am going to show you some brands. So either those brands or their generics, these are most commonly abused in the Pakistani context. And third one is, I cannot be held responsible for any kind of misuse of drugs. I am going to give you some examples, and if some of my attendees they start abusing that in the manner that I mentioned, so I cannot be held responsible. So don't do that. Okay, again I am saying categorically, don't do that. right? I am not favoring any kind of misuse. I will just give you some examples of misuse. And then user discretion is advised, because I will give you some examples that might not be suitable for for children, right? So let's start. First of all, my outline. This is my thesis statement. My thesis statement is we are all drug abusers, at least potentially. This is my first thesis. And I will try to justify it with examples, one way or the other, right? A lot of times we abuse the drugs, right? And then you are going to test your own knowledge. This is not a test. You are going to test your own knowledge. I'm going to show you commonly abused non-illegal drugs on the screen, and then you are going to answer either in the chat section, probably in the chat section, and also in the YouTube live streaming. In that chat section, you can mention, okay, this is the drug that I am talking about, why it is misused and how it is misused, right? And here is a key word: commonly abused, non-illegal, right? See, if heroin is concerned or opium is concerned, ये तो हर किसी को पता है ना कि there is an illegal substance, right? And that has another category, substance abuse. फिर उसकी scheduling होगी. But right now in this presentation, I will be focusing much more on the non-illegal drugs, right? So this is my first thesis statement. We are all drug abusers, at least potentially. And then my second thesis is we are all built for addiction. So the things that are discussed in this discussion session or presentation are applicable not only to Pakistan but also humans all across the world. We are built for addiction. In this, I am going to discuss nature versus nurture. I am going to discuss a little bit how we are wired to become an addict. This addiction could go for drugs, which is today's topic. But sometimes you must have noticed this even in your own personality. Either you are addicted to Facebook or addicted to YouTube or Twitter or these kind of stuffs, right? So that addiction, when it is applied to drugs, medicine, we call it drug abuse, right? Or drug addiction. Because one form of abuse is repeated use. Why would you use it repeatedly? Because you have become an addict. So I am going to define it in a particular way. And some of you might be amazed to know how addiction is officially defined. And then, of course, nobody becomes a drug addict without input from the nurture, from the environment, right? So I'm going to discuss a few of the things that a pharmacist or even a normal human being must keep in mind. You need to be able to sympathize with the people who are abusing drugs, right? Without helping them in their drug abuse. Just you need to be able to sympathize with them. You need to understand their situation, that it might not be their own fault. And of course, signs of drug abuse, and then what can be done. So, what can be done in Pakistan? I am going to discuss a few of the practical scenarios that the pharmacists who are actually working in Pakistan, they have informed me that okay, we deal with this kind of stuff in this particular way, both in community pharmacy setting as well as in the hospital pharmacy setting. Okay, so far so good. Let's start. We are all drug abusers, at least potentially. In this, I am going to talk about prescription medicine. You need a doctor to prescribe it, and others are OTC medicine that you can just go to the medical store and just buy it. And you and I both know in Pakistani context, you can buy almost anything. You can get away with it. So these are the realities of life. Now, I am going to define drug abuse, specifically prescription medicine. And this is how drugabuse.gov, which is an official site by the USA, right? They have maintained it. How do they define drug abuse? And see if it fits on your personality. Taking medicines in a different way than prescribed. There can be plenty of examples, right? Most common examples is antibiotics. If doctor says that you need to complete this course for 5 days, you say, "Oh, I'm fine," after 3 days or 2 days. So this is also drug abuse. Stop looking at the drug addicts, the common drug addicts that you see in the street sometimes. आजकल तो इतने नजर नहीं आते, but look inward. Taking medicines in a different way than prescribed. It is defined as drug abused. Let me shock you further. Taking a medicine that was prescribed for someone else, right? You talk to your friend and he tells you that for my headache, doctor prescribed me this medicine. You're also feeling headache and you say, "Oh, you felt headache and you got better with this medicine, so I am going to use it as well." This is also a form of drug abuse. And now many of you must be raising their hand. Okay, it fits on us. Okay, this is me. This is us. And let me shock you further. Taking a larger dose than you are supposed to. You are supposed to take 2.5 mg, but you go for 5 mg. So I'm going to give you some of the brands, and in the section of quiz, you are going to see which of these definitions fit on that. Using the medicine in a different way than you are supposed to. So I am going to give you some of the weirdest examples. I couldn't believe it. If it weren't for the pharmacists who were telling me, I would never believe it. But they told me that it happens again and again and again. And you are going to see some of the crazy examples of using the medicine in a different way than you are supposed to. And then using the medicine for another purpose, such as getting high. So this is most common. This you and I, we can recognize. But the other 4 examples, it can fit to a broader range of audience, right? So I can take questions after I mention the next slide, which is for drug abuse as far as OTC is concerned. Taking medicines in a way or dose other than directed on the package. In over-the-counter medicine, you have much more freedom, right? And if it is not prescribed, how are you going to take it? A lot of times, the instructions are mentioned on the package. If you are following the instructions on the package, it is OTC, over-the-counter. If you have to follow the instructions given on the prescription, it is a prescription medicine. So in a way or dose other than directed. And then taking medicines for the effect it causes. This medicine is not for that. This medicine is for the effect it causes. You're going for the effect. This medicine for alleviating your allergy symptoms, right? But since it is first generation antihistamine, a lot of them, and they have an effect of drowsiness, and you go for the drowsiness effect, then it is a form of OTC abuse. And the third form, mixing OTC medicine together to create new products, right? So one was for headache and another was for your stomach symptom. You mix it and get some sort of, euphoric feeling. It is also a form of OTC drug abuse. So at this moment, I can take your questions. And the moderator can help me in addressing those questions. Okay, we got a lot of questions. One is, what about drug abuse by physicians? So right now, my presentation, as you must have gathered so far, is focused on inward investigation. Look inward, okay? So in Pakistani settings, I will mention a lot of examples. Most of the burden of stopping drug abuse lies with the physician. Even people who are working in the hospital pharmacy, they told me that, okay, doctor checks it. And I kept asking them, what is the job of pharmacist? So even then they said that, okay, they talk to the doctor. So most of the responsibility in stopping drug abuse lies with the physicians. But it is not physicians' fault if somebody mixes OTC medicines. It is not physician's fault if he prescribes the medicines for 5 days and somebody uses it for 2 or 3 days. So it is not physician's fault, right? And I was convinced that a lot of times physicians and pharmacists are not responsible. It is just human nature, because my one thesis was we are all drug abusers, at least potentially. And my second is we are all drug addicts. So I am going to justify my thesis statement. Okay. What about when people are adamant on getting self medicated and choose it on their own? Okay. Yeah, I don't want to get lost in the semantics, but this form is that taking a medicine that was prescribed for someone else, taking a larger dose. So a non pharmacist is prone to make that kind of mistake. So that person will be abusing the drug in the category of taking medicine in a different way than prescribed. So avoid self-medicating yourself if you're not a qualified pharmacist. If someone is not complying with the drug frequency, it's like irrational or drug abuse. Yes, drug frequency is also comes under the heading of using it in a way that is not on the package or that is not prescribed for you, right? So there are a lot of things that we can discuss under the umbrella of drug abuse, but I am going to focus much more on the my thesis statement. We are all drug abusers. So now, and this must shock you, 90% of addictions, repeated use, start in the teenage years. 1 in 6 teens have used medicines to get high, just to get a good feeling. And 27% of teens and 16% of parents believe that using prescription drugs to get high is safer than using street drugs to get high. And a pharmacist told me that the normal mentality is, I'm using Xanax now. It is better than using any street drug. खैर है, we are not using heroin now. It's okay. इतना तो नहीं है. If you set your standard to such a worst degree, if you set your standard, if everything you are abusing, you are going to match it with heroin, then everything is allowed, right? Right? Then you can't stop drug abuse because your standards are so low. And this is way more common. कि यार एटीवैन ही लेते हैं ना यार, एविल ही लेते हैं ना यार, एंटी हिस्टामीन ही है ना, फलानी चीज तो नहीं है, और यार हम सिगरेट तो नहीं पी रहे ना. So this is a kind of common conversation that we face as pharmacists. Now I'm going to show you some of the commonly abused drugs in Pakistan, in which you are going to see some of the drugs that make sense. Their abuse makes sense. It is not okay, but it makes sense that, okay, somebody is using it. It makes sense. And there will be some of the drug abuses that will be so crazy. So you must have seen this type of drug abuse. Now your job is to mention which category of drug this belongs to. And second, is it a prescription medicine? This is your job. And whether its use makes sense or not. So I have given you 3 formulation. One is 5 mg tablet, second is 10 mg tablet, and then you have an ampule. So you can mention it in your YouTube live stream chatting or in the over here as well. And the moderator will transfer to me your responses. Valium, diazepam. यार एक वैलियम की गोली खा लेते हैं, यार नींद नहीं आ रही, right? I won't name the person, but even one of the most famous politicians they mentioned its name. They said that it is better than, you know, being crazy. I take Valium or diazepam. I believe that person mentioned Valium. So this is very common. And as far as big cities are concerned, there are still checks and balances. If you go to rural areas, you'll be amazed to see how much drug abuse is prevalent in those areas. So I am getting some of your responses, and moderator is also okay. Yes, you are getting it right. Diazepam must be used with prescription. Without prescription, you cannot use it, right? It is a prescription medicine. Okay. And there are two main classes of drugs. This belongs to the benzodiazepine category, but also barbiturates and benzodiazepine. They act on GABA receptors in the brain, and chloride channels open. When chloride channels open, they have a suppressant effect. The opposite is glutamate. So this was some of the jargon that has been mentioned, but only this. So its use makes sense. You want to sleep. You want to get away from the realities of life. So this is one of the most common. The generic diazepam. And also this brand is also very common. Valium. Most of the people, they recognize it with Valium. Chloramphenicol eye ointment. And it shocked me to realize, to know what was its drug abuse. A lot of people in rural areas in Punjab, they use this eye ointment for piles. Bawasir ke liye. They use it for piles and they apply it to that area. Right? So this is one of the crazy uses. This is one of the crazy uses of chloramphenicol eye ointment. Now the question arises, do they get better? Do they get better? But that question is irrelevant when you are discussing drug abuse. There are better formulations available for treating piles, right? So there are better formulations available. So people have started using this chloramphenicol. So this is an example of crazy uses of medicine. And chloramphenicol, it's an antibiotic. So it must be prescription medicine. So you can Google it. Is it a prescription medicine or not? I believe it is a prescription medicine. So you can check it out. Chloramphenicol. But in Pakistan, even this is the reality. You can go to the drugstore and you can simply buy it. And this is also a fact that 90% of pharmacies in Pakistan, especially most of them, they are in the rural areas and villages. They are run by non-pharmacists. And if patient asks for compounding or suspension or ask for any type of drug, the seller, they are just sellers. They just sell it in drugstores, right? So these are the realities of life. So example of Valium, it makes sense at least. Example of chloramphenicol eye ointment, and there must be a lot of other examples. So this was one of the examples that a pharmacist quoted to me. Ativan, lorazepam. This is another example. Barbiturates and benzodiazepine, same GABA receptor activation. One of the category, it increases the frequency, and other, it increases the duration of chloride channel. The main effect is suppressant effect. You want to get away from the realities of life. You want to sleep, sedating effect, right? Okay. So now, of course, you must have guessed that this is a form of prescription medicine, right? It must be prescribed by a competent authority. And also, I can guess in 70% of the households, this generic form, lorazepam, must be available, right? So these are the realities of life. Help. A person mentioned it in YouTube live streaming chat session. So help is much more common. Help is also common. This formulation, the drug help. And the famous one that you must have read in your lectures is Xanax. But Xanax is a bit expensive, so people go for help. So this brand is also, its abuse is very common. So this is not to demonize any pharmaceutical company or not the product. The product is working fine. It is not the fault of pharmacist or the person, the physician, but people use it to get away from realities. So alprazolam, you guessed it right. This is its use makes sense. It is at least not crazy. Prozac, fluoxetine. So my question is, which category of drugs fluoxetine belong to? Is it a prescription drug? So these are my question. And third, does its abuse make sense or not? Is it crazy? So this is my question to you. You can mention it in the chat section. Okay, I am getting a lot of interesting answers as well as other questions. And really, I'm enjoying your participation. Yes. Okay, so I got a question. What is an actual abuse of drugs? So for that, one of my previous slide mentioned five criteria. If it fulfills any of the criteria, it will become prescription drug abuse. And if it fills the other criterion that I mentioned for OTC medicine, then it will come under the heading of OTC drug abuse. So drug abuse that I am talking about are non-illegal drug abuses. Okay. So far, so good. So fluoxetine is antidepressant. You guessed it. It is SSRI, selective serotonin reuptake inhibitor. Because we don't know properly the brain chemistry, so we try to manipulate a lot of neurotransmitters, a lot of chemicals that are going on in our brain. So one of the ways is to selective serotonin reuptake inhibitor to increase serotonin levels, right? And it is an anxiolytic, right? Because हम टेंशन में नहीं जीना चाहते, right? So these type of drugs are most commonly abused. Moving on, tramadol, analgesic agent. Now your job is to mention yes, and your answers are so far so good. Your answers, you are going in the right direction. These examples are examples of prescription medicines. These examples are of prescription medicine. It is available, its tablets are misused, its capsules are misused, and also ampules are available, right? And you can see in the ampule, the solution for injection intravenous. इंट्रावीनस लगाने में थोड़ा सा आपको एक्सपर्टीज चाहिए, थोड़ी सी इंट्रावीनस, बट इंट्रामस्कुलर भी है एंड सबक्यूटेनियस भी है. Since its use, it is its use, it can be used in multiple ways, which enhances its potential to be abused. And of course, tablet and capsule lena to phir it's very easy. Okay, I got an interesting comment. As long as the drug benefits someone and not produces harm, it not abuse. It's an excellent question. And the answer is no, right? Drug abuse does not depend on your perception of it. It doesn't depend on subjective thinking. Otherwise, who would in their right mind abuse a drug? हर कोई यही कहेगा ना कि यार ये हम अब्यूज नहीं कर रहे if it depends on perception. So drug abuse does not depend on your perception. It has 5 criterion that I mentioned in one of the slides, right? For prescription drug abuse. And these criteria for prescription and non-prescription are set by hundreds, or I won't be amazed if it is set by thousands of people, because they provide their data, research is published, a lot of case reports are published, then there are meta-analyses, and then the information appears in the books, and the authorities, based on the research from all across the world, they develop these criteria. Each and every word is calculated when they describe the criterion, right? So even if you think that it is giving you some form of benefit, if you take it in any other way mentioned on the package or in the prescription, it will come under the heading of drug abuse. Okay, moving on. This is Voltaren ML gel. As you can see from the picture, it is used, it has diclofenac. Okay, so this is used for joint and muscle pains. So can someone guess how it is abused? And the person who told me, he's a pharmacist in Saudi Arabia, and that person told me a crazy thing, how people there use it, how people abuse this Voltaren ML gel. So it is your job to guess how they abuse it. And it says temporary relief of local pain and inflammation. And that person also told me that it works and its use is crazy use. But I leave it up to your imagination. Guess how people abuse it. So I'm waiting for your answers. You can mention your answers in the Zoom and as well as in the YouTube live stream. And I have been told that in YouTube live stream, there is a 4 second or 5 second gap. So I move on to the next slide and that slides appear after a few seconds on the YouTube. So that's fine as long as you are able to participate in the discussion. That's the entire purpose of today's today's session. If you participate in it and uh, okay. Okay, someone mentions that fluoxetine is a happy pill. So we have crossed that slide. So right now, my question is how Voltaren can be misused. Go wild. How it can be misused. Something that is for temporary and local pain and inflammation relief, how it can be misused. And the formula is diclofenac. And Voltaren, uh, Voltaren, I believe it is available in Pakistan. So time for the answer. People rather misuse Voltaren ML gel for their headaches. It's so crazy. It says temporary relief and local pain and inflammation. So people use it on their forehead to get rid of headaches. So it was so crazy to see people, to listen about it. So people use Voltaren ML gel to treat their headaches. So this is not the way it is marketed. This is not the way this ML gel is built, but people use it. And even if it gives benefit to the people, even if their headache is relieved, even if their headache is relieved, it is still drug abuse, right? Okay, some of you are really going crazy with your comments, and you are absolutely right. You may be absolutely right, but the side effects, but the abuse that I learned from the actual pharmacist in practice, that is different of Voltaren ML gel. So this slide shows a crazy use. Okay, moving on. डायरिया के लिए बच्चों और बड़ों के लिए दोनों के लिए मुफीद लोमोटिल. Its component diphenoxylate. That's where danger starts. Okay, so now you have to say, you have to mention now you have to mention, is it a prescription medicine? And the answer lies in the slide as well. It's advertisement. डायरिया के लिए बच्चों और बड़ों के लिए दोनों के लिए मुफीद दवाई, बच्चे बड़े दोनों यूज करें. So this is how it was advertised, right? So your job is to mention, is it a prescription medicine? And second, which category diphenoxylate belongs to? And the use is also on the slide as well. It is used for diarrhea. And I am going to give you one of the logical examples of drug abuse, and one of the crazy example of drug abuse that I was astonished to hear about it. Okay. Yes, I can wait. Okay. So some of you, they guessed it right. Diphenoxylate, it belongs to the opioid category, right? So opioid, there are various receptors. This diphenoxylate and another famous brand, loperamide, they act on mu receptors. Mu opioid receptors, they act on intestinal motility. So they decrease peristalsis. So that is how they alleviate the symptoms of diarrhea. It makes sense, right? It makes sense. And I said peripheral receptors, but it can also cross the brain. And there it can act on opioid receptors, right? And have some calming effect or euphoric effect, or effects that are not intended, but people use it for those actions. And now, are you ready for its crazy use? Are you ready for its crazy use? I was astonished to learn about it. Some people abuse it, and they told the pharmacist, some people abuse it to get the feeling of diarrhea, to get the constipated feeling. So this is a crazy use. One use makes sense. One form of drug abuse, it makes sense. It crosses the blood-brain barrier and has some effect, right? It gives some, uh, calming effect. So this abuse makes sense. But there is another form of drug abuse. The feeling at the local area in your body, the feeling of constipated feeling. Some people like that feeling. So they abuse this drug, especially this brand. So crazy and makes sense. Now, evil. Evil is also very common. Phenyramine. And it is written on the label. It is antihistamine and anti-allergic. And anti-allergic are notorious for their drowsiness effect. But not all of them there is a classification. Mostly the drowsiness is associated with which generation of antihistamine. So it is your job to mention it in the chat of Zoom or in the YouTube live stream chat. You can mention it there. You can Google it, that's fine. Rather, I would encourage you to Google it. Google it and uh, then don't copy paste it at least, but learn it from Google and then type it on your own. That will help you in memorizing a lot of this stuff. And you must have noticed Avil syrup, and it is in the definition of syrup, those are sweet, right? So on one hand, you have a tablet. On one hand, you have an ampule, and other is syrup. Syrup is easy to take. And tablets are small. Tablets, you need water to take the tablet with. But with syrup, syrup is sweet. So abuse can be in many forms. Ampules, वो तो चलो professional drug abusers आ गए ना. The tablet and the category of syrup, its abuse may be applicable to even us or someone we know, right? Okay. So I got your answers and they are all correct. Right now, I'm not judging anyone. You're all correct. And I want wrong answers as well. So I got an answer first generation anti allergic. Yes, first generation antihistamine, right? And they also have some other side effects, but we are not going into the anticholinergic and other effects. But because since they cross blood brain barrier and their antihistamine effect, you need histamine for your daily activity. But since those are blocked, H1 receptors, those are blocked, then you get a calming effect, drowsiness. Moving on, purine. I am going to show you a crazy drug abuse of these eye drops. One crazy abuse I showed you of chloramphenicol eye ointment, that people use it for piles. And this is another formulation. Exactly this brand is used as told by one of the pharmacists. So can you guess how someone can use this eye brightener, nefazoline? How someone can misuse it? So I will give you the example how people misuse it. Okay. So your time is up, and some of you have already Googled it, how it is used. Nefazoline, yes, it is a vasoconstrictor. It has sympathomimetic effect. Vasoconstrictor. And it narrows the swollen blood vessels. The effect is that you get white eyes like those of actors and actresses. And who misuses it most of the time? Drug addicts. In the slides when I'm going to show you signs of drug abuse, there the bloody sort of eyes, the swollen eyes, it can be uh, one form of one form of signs, one of the signs of drug abuse, right? So drug addicts, to deceive the pharmacists, they use Curine eye drops, and then they go to a pharmacy and ask for an anxiolytic or muscle relaxant. And one of the pharmacists, he told me that a lot of the addicts, they go to the hospital and they say, "Oh, I'm having pain. It's kidney pain. I know, but I don't have prescription for it. But I'm in so much pain." And people in the emergency department, they have to give them some sort of muscle relaxant or other anxiolytics. So that is another form of drug abuse that addicts are most commonly engaged in. So these eye drops, their use is not crazy, but addicts use it, right? Charsi use karte hain, right? And you can relate to some of the, a lot of guys, They may use some of the street drugs or substances. So they can manifest, their effects can manifest in their eyes, bloody eyes, swollen eyes. So they use these type of eye drops. So its use is not crazy, but crazy people use it. I shouldn't call drug addicts crazy. Sorry. Because one of my theses is that we are built to be addicts. So I can't call them crazy. I apologize. Okay, Nalbin injections. Nalbuphine. So I personally know a woman who was hooked on Nalbin injections. So these are also anxiolytic and have their sedative effects, right? But so far, in all of my examples, I haven't given you anything that makes you excited. So that example is going to come in next slides. Corex, it's like hydrolyne DM syrup. It has dextromethorphan, cough suppressant. But since it crosses blood-brain barrier, so it has some drowsiness effects. Corex D, it is misused and other formulations where you have dextromethorphan. So dextromethorphan is one of the commonly misused drugs. Drug abuse is also known as drug misuse. And a person and a pharmacist in Sindh, he told me that people use hydrolyne DM in a lot of their drinks. Hydrolyne DM, this cough syrup, and they pour it in their drinks, and the taste of hydrogen DM in their drinks, it gives them some sort of pleasure, and since it has dextromethorphan, so they have a calming effect. So these are various forms. Another dextromethorphan, combinol D, you can buy it in common drugstores. So this is also a form of non-prescription drug medicine. Phenergon, potent antihistamine. So I'm moving forward because I want to move to my next thesis statement: how we are all addicts. Phenergon, it is very commonly abused. It is used to make children sleep because parents, they can relate to it. They can relate to the sleepless nights, right? So to avoid that, they give this promethazine and the child sleeps throughout the night. But it is a misuse. You don't know what are the long term consequences of blocking histamine in a child's brain. So don't do that. But in villages where they have a line of kids, I'm not denigrating anyone, but people who have in villages especially, women who have multiple kids, they directly or indirectly want some soothing syrup, something sweet that they can give to their kids so that they can sleep all night because they have multiple children. So Phenergon, amoxicillin, it is an antibiotic. And a pharmacist, if you want to poke a pharmacist is not talking to you. Just say the word antibiotics and pharmacist will start lecturing you because it is our dukti rag, amoxicillin. But now it's crazy use. Antibiotics not using the way it was prescribed. It is drug abuse. But the crazy use, people open up this capsule and pour its content on their wounds and also on their bruises. So this is a crazy abuse, right? So there is an interesting question. Should we stop Finargan or stop overpopulation? So I am going to go with stopping the overpopulation. Okay. I've got another question. Okay. Why all the syrups which are used for coughs and chest pain give sleep and pleasure? So I'm going to say that not all syrups, because when you're coughing, right? When you are coughing, you are in stress, and something sweet, it also feels good. So these formulations, there is an entire science of developing formulation. Why is it in the tablet form? Why not capsule? Okay, if it is in a capsule, why not in a syrup form? And also, what is your target population? So a pharmaceutical company has to take a lot of factors, a lot of criteria into account before launching any product, right? So that is why syrups, right? You want something sweet. So I gave you an example of crazy abuse of amoxicillin, especially these tablets, and logical. Logical is that, okay, antibiotics, you are feeling better, okay, you stop taking them. It's not a good thing that you did that, but that's how people abuse and misuse it. So this is an example that was given to me by pharmacists. These are velo pouches. These are nicotine pouches, right? These are nicotine pouches. And yeah, cigarette to nahi pee rahe na. So how are they used? Those are, I thought those are available in other countries, but in their YouTube channel, I found that this is available. 160 रुपए का मिल रहा है, ठीक है? And since in my disclaimer, I told you that I'm not, promoting any of these products. I'm just mentioning you the realities of life. How people use it? They put this pouch. It has a lot of pouches. So they pouch nicotine pouch, their gum and lips. They place it there, and that's how they get the feeling of high feeling, right? And see how it is marketed: sweetener, fibers from eucalyptus and pine trees, so that a person who doesn't know better, he will say, oh yeah, natural products, wow, naturally derived. But it is a form of drug abuse. That is not, first of all, nicotine itself. If you are shifting from a cigarette to a nicotine pouch, then it doesn't mean that you are not abusing the drug nicotine, right? Nicotine patches are available, and physicians prescribe it based on the condition of the person. If a person is a chain smoker or something related to it in this regard, then a doctor can prescribe nicotine patches. But if a person shifts to another nicotine pouches and use it in that way, it will be a drug abuse. And which drug is being abused? It is the nicotine. Nicotine is a drug that is being misused. Its formulation is to blame. Now we go with, we are built for addiction. At this time, at this moment, I can take selected questions. Okay. Another observation is, prescription plays a major role in abuse, mainly how it can be prevented. So we are going to talk about how, what is the job of pharmacists or how we can stop it. But first, we need to realize a very important component, which is we are built for addiction. And I won't say that it is the prescription drug abuse that is much more common. um, I am neutral in this regard, because the stories that the pharmacists who are actually working in the hospital setting and in the community setting, they told me a lot of crazy stories. So after listening to those stories, I stopped blaming physicians as well as pharmacists. Right? We are built for addiction. Drug addiction. You'll be amazed to know how drug addiction is officially defined. It is a chronic brain disease. It is a disease. So treat it like that. Don't say that it is your character's fault. It doesn't lie with the character. It is a brain disease. Treat it like that. It causes a person to take drugs repeatedly despite the harm they cause. Do you think a lot of drug abusers, they don't know that they are harming themselves, but still they do it? Because they are afflicted with a disease. And the brain changes from addiction can be lasting. So drug addiction is considered a relapsing disease. This means that people in recovery are at risk for taking drugs again, even after years of not taking them, right? So people who have seen House MD series, they can relate to it, right? House MD series, it was very famous series in which a physician, a brilliant diagnostician, I should say, a person who diagnoses, he was addict, right? And now I am going to give you the physiology of drug addiction. Before that, I should mention the statistics. Women, men are most likely to misuse their prescription pain medicines, and women are less likely to misuse or abuse prescription pain medicine. But ट्रीटमेंट फॉर स्लीपिंग एड, कि यार बस सो जाएं, बस बस यार इस टेंशन से जान छूटे, बस हमें सुला दो, it is much more common in women. And this data, it was mentioned in the drugabuse.gov website. Although it is United States data, but you can see that there is some gender has a role to play, that men are prone to misuse or abuse prescription pain medicine, and women are prone to misuse or abuse sleeping medicines. और मेन का तो बॉयज का खासतौर पे कि हमें एक्साइटमेंट चाहिए, तो वेमेन का ज्यादातर मिसयूज 55%, इनका जरा ज्यादा है, मिसयूज वेमेन का ज्यादा है. ओके, दिस स्लाइड गिव्स यू द फिजियोलॉजी ऑफ एडिक्शन. Without discussing it, you cannot begin to understand, let alone treat drug addiction. So I am going to spend just 5 minutes to explain what is going on over here. And sorry for the jargon. Jargon किस चीज का है? Jargon, let me use my pen to highlight some of the areas given. There are some parts of the brain: ventral tegmental area 1, 2 amygdala, 3 nucleus accumbens, 4 prefrontal cortex, 5th is hippocampus. Common theme is ventral tegmental area, VTA. Okay, it is part of midbrain. So what happens is, this ventral tegmental area, it talks to your amygdala, it talks to your hippocampus, it talks to your nucleus accumbens, it talks to your prefrontal cortex. And hippocampus has a role to play in memory. Amygdala has a role to play in your emotions, in your happiness or depression. And nucleus accumbens has a role to play in movement, and prefrontal cortex has a role to play in executive decisions. Just like you decided to take part in today's webinar, the decision was the product of the networks, but your prefrontal cortex played a major role in making that decision. You sat down and opened up your laptop or cell phone and pressed some buttons to log on to YouTube or Zoom. It was nucleus accumbens that was doing it. And then amygdala, emotions, some sort of emotions. Okay, I'm going to learn something. I know this person. Okay, I will enjoy this session, or whatever was in your mind. And hippocampus, it plays a role in memory. So now let's review this slide in the context of a drug. If drug gives you a happy feeling, amygdala is involved, and amygdala talks to hippocampus. memorize it. Let's memorize it. It was so much fun. Let's memorize it. And then the communication is also transferred to nucleus accumbens. Okay, move for it. I want this feeling, move for it. And then prefrontal cortex makes the decision of opening up the medicine cupboard and start abusing a drug. In short, the decision to abuse or addiction is deep within your brain, and a lot of different parts, they play their role in making a person addict, right? Even कुछ लोग अगर आप में से कोक ज्यादा ड्रिंक करते हैं तो same formula applies over there. Ventral tegmental area talks to amygdala. Oh, I'm enjoying this feeling. It is so sweet. It is lovely. And hippocampus memorizes it. Okay, whenever I drink Coke, it is so much fun, right? And nucleus accumbens is compelled to open up the fridge and take out the bottle. And prefrontal cortex, it makes the decision, okay, yes, I want to drink Coke. So this thing goes on in your brain. So amygdala is deep within your brain. Consider it your subconscious. Consider it. But subconscious is a different category, but it is not in your direct contact. Fine. Hippocampus. It is not in your direct control. Nucleus accumbens. It is not in your direct control. Although nucleus accumbens, its physiology is much more complex. But right now, as for today's discussion, consider it out of approach. How can someone stop being an addict? The only region which has to play its major role in stopping addiction, that can be under your control, is your prefrontal cortex. Executive decisions, lecturing, अगले को लेक्चर कर सकते हैं. यू कैन शो सिंपैथी कि भाई नहीं करो यार, तुम्हारी एडिक्शन से तुम्हारी फैमिली डिस्ट्रॉय हो रही है. तो आपने एडिक्शन को कैसे स्टॉप कर सकते हैं? यू कैन टॉक टू द प्रीफ्रंटल कॉर्टेक्स, बिकॉज अदर रीजन्स दैट आर मेकिंग यू एन एडिक्ट, दैट आर डेवलपिंग अ हैबिट, are not in your control that much. Which part can be in your control is your prefrontal cortex, executive control, right? So executive control फिर ventral tegmental area और दूसरे region से बात करके कह सकते हैं कि अच्छा भैया बस कर दो, बस. I have decided, okay, it gives me a pleasurable sensation. Amygdala is happy. It will give me a pleasurable sensation. But executive control, it talks to amygdala and says बस कर दो, बस. It talks to ventral tegmental area और उसको कहेगा भाई बस करा दो, बस हमें नहीं चाहिए, right? So this internal circuitry, it determines whether a person becomes an addict or not. So this is your nature. You can't do much about it other than talking to the prefrontal cortex. अगले को समझा सकते हैं, अगले को educate कर सकते हैं. Moving on, this slide shows that drug addiction is the product of biology, your genetics, your gender, and other mental disorders partly determine your propensity for addiction, and environmental factors just like chaotic home and abuse. घर में अगर पेरेंटल अब्यूज चल रहा है या कुछ और चल रहा है, घर में इतनी स्ट्रेस है, तो one of the means is doing something about it. But if you can't do something about it, then another way is to escape altogether. ठीक है? And what is the best form of escape? Best not in a positive connotation. What could be the best form of escape? Drugs. So people go for drugs. So you need to be able to sympathize with it because you don't know people's history. You don't know. Our life trajectory is mostly determined. I would say more than 90% is determined where we are born, which is not in our control. So how can you judge an addict? You can't judge anyone. And then these drugs, they change the brain chemistry. Amygdala is involved, hippocampus is involved, nucleus accumbens wants to, go for that prefrontal cortex, its decision making capability is compromised, and you are only thinking about getting that pleasurable sensation. Amygdala, you want to involve the amygdala, right? So, drug addiction. Signs of drug abuse. These are some of the signs of drug abuse. Poor academic performance. Since I believe most of the participants are students, so a person who was performing very well in their first year, second year, and then their academic performance, it starts plummeting. So it can be a sign of drug abuse. Now, don't start pointing fingers to one another. Okay, you might be a drug abuser because you got first position, now you are third position. So that doesn't work like that. So these are some of the signs of uh, drug abuse, addict, especially in the context of addiction. Drastic changes in weight, money problems, because all you care about is stimulating this circuit, is stimulating your amygdala. All you care about is stimulation. You want that stimulation. And even if you have trouble with the law, right? A withdrawal from friends and activities. You engage with your friends to get some sort of stimulation, to learn something. Learning is also enjoyable, right? Gossiping, किसी को enjoy करने के लिए, किसी की gossiping के लिए, right? You do that, Facebook, Twitter, and rest of the stuff. But once you get the feeling from the drugs, you start withdrawing from the friends. कि यार जो मजा इस फ्रेंड से गपशप करने में आता है ना, या सर्टन एक्टिविटी को ज्वाइन करने से आता है. आई यूज टू गो टू जिम, but I get much more happy feeling, much more high from a drug. So you will withdraw from your friends and activities and move towards drugs. Excessive sleepiness. So sleepiness ke bhai hum, because in sleep we are not bound by the space time continuum. We're not bound by that. We see a lot of crazy stuff, and a lot of times we are in much more control of our lives. So excessive sleepiness, you want to get away from realities of life. And this is another presentation of signs of drug abuse. Sudden weight loss, neglect in grooming, कि सेल्फ केयर ही खत्म हो गई, मैं कपड़े बदल कर जाऊं कहां और बाल बनाऊं किसके लिए. यू नेग्लेक्ट grooming yourself. Bloodshot eyes, right? And I gave you one example. किसी को वो आई ड्रॉप याद है? वो आई ड्रॉप कौन सा था जो इस तरह की ब्लड शॉट आईज को ठीक करता है? सो द पर्सन प्रिटेंड्स दैट दैट पर्सन इज नॉट एन एडिक्ट और अ ड्रग अब्यूज. कैन समवन मेंशन दैट? Yes, I can wait. Meanwhile, I can take up some of the questions. Okay. So I got a couple of questions. Your job is to mention the eye drop that I mentioned for bloodshot eyes. Right? In the chat, I have. Okay. 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 On a scale of 1 to 10, how bad is smoking addiction? Can a person overcome smoking addiction? Is smoking irresistible? So after that slide, you cannot judge a chain cigarette smoker. You cannot judge. First of all, आपकी job है उसको judge नहीं करें, because we are built for addiction. ठीक है? I hope I have convinced you that we are built for addiction. Second, on a scale of 1 to 10. So it depends on your situation, your age, and your company. If you are a parent and you have a small child, so how would I rate you from 1 to 10? Right? You will rate it yourself, right? And this is also a common argument. Yeah, if I don't smoke this cigarette, I will go into depression. So in those cases, instead of taking up smoking, you can also go for counseling, right? Counseling हमारे यहाँ तो बस यही है कि दो जूते लगा के ठीक कर दो इस बंदे को, but there is a real thing, counselor. Even your friend can be a counselor. You can talk to someone. The feeling that you get from smoking, you can replace it with other forms of happy feeling or feeling of thrills, right? Okay. Oh, how Sting, a soft drink, is harmful for young girls and pregnant women. How it affects on the body. So Sting is one of the examples जो कि energy drinks आजकल बहुत ज़्यादा है. And I have seen people bringing those energy drinks into the gym, and after 3 sets or 4 sets, they start using it. They start this drinking it because it gives them some sort of immediate energy because they have plenty of glucose, right? So, in those cases, I would say replace it with something better. Replace it with something better. Don't go for immediate happiness. Always go for contentment. Sukoon, itminan. Right? Okay. One comment that I got is so much funny. Sir, पंजाब में अभी भी यही कहते हैं कि इसकी शादी करवा दो ये ठीक हो जाएगा. So I am not recommending it. Right? I'm not recommending it because in my Finargon slide, I mentioned that this will also happen, right? You need to see your circumstances because before, populating the planet. Moving on, what can be done? So in Pakistan, what is the situation? First of all, let's see what's the situation here. Here in hospital pharmacy settings, especially the hospitals that are well established, so they have their own prescription format. So they can see that this drug is prescribed by an authentic physician. So in Pakistani settings, if doctor has prescribed it, pharmacist doesn't challenge it. So this is the reality. ठीक है? बाहर के मुल्कों में different situation है that I'm going to talk in a little while. बाहर के मुल्कों में क्या है? यानी ideal situation में तो यूएस में एक सिस्टम है, इट इज कॉल्ड पीडीएम, प्रिस्क्रिप्शन ड्रग मॉनिटरिंग. अब प्रिस्क्रिप्शन ड्रग मॉनिटरिंग क्या है? मैं इसकी साइट पे गया था टू चेक व्हाट हैपेंस इन प्रिस्क्रिप्शन ड्रग मॉनिटरिंग. सो प्रिस्क्रिप्शन ड्रग मॉनिटरिंग इज अ डेटाबेस, एक फुल डेटाबेस है. इट हैज नेम्स ऑफ पीपल कि भाई ये ऑथराइज्ड फार्मेसीज है जहां पे ये ड्रग्स अवेलेबल हैं, कंट्रोल सब्सटेंसेस हैं, एंड इट हैज लिस्ट ऑफ फिजिशियंस कि भाई दीज फिजिशियंस आर ऑथराइज्ड और ये इस तरह प्रिस्क्राइब करते हैं. If you see something shoddy going on, there is some shoddy business, then a pharmacist logs on to prescription drug monitoring and then he reports it. कि भाई I got a prescription for person X and doctor in this state, he or she prescribed it, but that person got the medicine of a related category just 2 days ago. He doesn't need it. Why is he bringing a new prescription? So that person can record it in PDM program. And then the pharmacist can reject the person despite having the prescription. Okay. But what about Pakistani setting? So a pharmacist told me, if you are doubtful and if you think there is some shoddy business going on, in those settings, pharmacist just refuses. But one pharmacist told me that that person was in hospital setting, and that pharmacist told me that they call the security. Even if that person has the prescription, first of all, they call the security because drug addicts, they are prone to getting violent, right? So first of all, pharmacist's job is to call the security. Security guard is right there. It doesn't touch the person. Then the pharmacist can outright reject the prescription, filling of this prescription, or that pharmacist say, okay, you mentioned 30 tablets. I can give you just 4 tablets right now, right? These are two of the ways in which Pakistani pharmacists are playing a positive role in reducing drug abuse and addiction. But most of the power, it lies with the physicians in Pakistani settings. But in US settings, pharmacist is much more powerful. I have seen it with my own eyes, how pharmacists can challenge a doctor and pharmacists can change the prescription, compel the physician to change the prescription, right? So I have seen it with my own eyes. So these are the ways in which pharmacists can reduce, or in sometimes, in many cases, they can prevent the drug abuse or addiction cases, right? And I can also take up questions if you have some questions regarding it. And there are a lot of videos available, educational videos by pharmacy authorities in USA, that gives you red flags, that if you see a person presenting with pointy eyes, or a person is fidgeting too much, or a person is coming with groups, or a person always comes in busy hours, so that you are not able to appropriately or thoroughly analyze the situation, thoroughly read the prescription, because that person always comes in busy hours. क्या आप बिजी होंगे, जल्दी जल्दी आपने दे देना है. एंड इन पाकिस्तानी सेटिंग यू मस्ट हैव सीन, ओ यार दे दो ना यार, यार ये पेशेंट आया यार, इसको जल्दी करो यार, ये जल्दी करो. सो दीज आर रियलिटीज ऑफ लाइफ. I hope when you graduate, you don't do that. You are always mindful of the situation. यहां पे होता यह है कि रश आवर्स में 3 फार्मासिस्ट भी कम है एक फार्मेसी स्टोर पे. एंड व्हेन इट इज नॉट रश आवर, सो 1 फार्मासिस्ट या 2 फार्मासिस्ट इज सफिशिएंट. सो व्हाट हैपेंस इज कि वो जो बिजनेसमैन है जिसकी ये फार्मेसी है, बिकॉज लेट्स फेस इट, इट इज द रियलिटी ऑफ लाइफ. इट इज द बिजनेसमैन हु हायर फार्मासिस्ट. ठीक है, अ लॉट ऑफ टाइम इट इज नॉट द फार्मासिस्ट हु ओन्स द बिजनेस, इट इज द बिजनेसमैन. So if a businessman sees that in rush hours you need 3 pharmacists, but in typical conditions only 1 will do, so he will hire only 1, और उसी पे प्रेशर डाल के रखेगा. This is the reality of life. वो अपने 2 रुपए बचाने के चक्कर में बहुत सारी फैमिलीज को डिस्ट्रॉय करने में उसका कुछ नहीं जाएगा, बिकॉज ही इज अ बिजनेसमैन. ही वर्क्स इन द प्रॉफिट मॉडल. So how can we go about it? So one of the ways is mandatory presence of pharmacist, and the second way is controlled substances. तो वो हर फार्मेसी में controlled substances की कैटेगरीज है. तो वो चूंकि आज का मेरा टॉपिक नहीं था, आज का मेरा टॉपिक ये था वो प्रिस्क्रिप्शन एंड नॉन प्रिस्क्रिप्शन जिनसे हम रिलेट कर सकते हैं. फिनरगान यार फलाने के घर में हमने देखी थी. सो आई डिडंट टॉक अबाउट रिटेलिन. रिटेलिन बहुत ज्यादा मिसयूज होती है, रिटेलिन, मॉर्फिन वगैरह. मॉर्फिन जो है ऑन्कोलॉजिस्ट बहुत लिखते हैं. लाहौर में शौकत खानम है, लेकिन टिपिकली हॉस्पिटल फार्मासिस्ट टोल्ड मी दैट आजकल पंजाब में नहीं मिल रही, तो कराची से बहुत ज्यादा लोग मंगाते हैं. शौकत खानम से भी प्रिस्क्रिप्शन आ रही होती है, तो दैट पर्सन हैज अ लिस्ट कि शौकत खानम में भी ये ऑन्कोलॉजिस्ट हैं जिनकी हमारे पास लिस्ट है. तो उसमें तो ऑलरेडी बहुत ज्यादा लोग माइंडफुल हैं. लेकिन टिपिकली इन आई ऑइंटमेंट्स में पीपल आर नॉट इंटरेस्टेड. तो आज की ये जो हमारी डिस्कशन थी ना, ये बहुत सिंपल लेवल पे थी कि कई दफा बुराई अगर वो बहुत हाई लेवल पे हो, वो तो बच्चे को भी पता है कि यार ये अब्यूज चल रहा है, लेकिन कई दफा अब्यूज हो रहा होता है एंड यू आर नॉट एबल टू जज. तो आज की प्रेजेंटेशन में होपफुली यू हैव सीन some of the examples in which you can see where we are going and you can sympathize, because my story was your story, right? We are all prone to drug addiction, right? Because हमारी circuitry ऐसी है, and there is positive work going on. So I googled कि drug abuse का क्या होगा. तो first of all मुझे मिला एक आस ट्रस्ट है, वो नॉन प्रॉफिट है और वो काउंसलिंग करते हैं, थेरेपी करते हैं, फॉर्मल और नॉन फॉर्मल. इनके 8 सेंटर्स है, कराची में 1 लाहौर में. और मैंने डिस्क्लेमर में कहा था कि आई एम नॉट प्रोमोटिंग एनीथिंग, मैं इनको प्रमोट नहीं कर रहा आस ट्रस्ट का, आई डोंट नो अबाउट इट. बट इस वेबिनार के लिए मैंने रिसर्च तो किया कि हमारी ग्राउंड रियलिटीज क्या है. तो इस सेमिनार में मेरा मेन फोकस ये था कि हमारी ग्राउंड रियलिटीज क्या है. दैट इज व्हाई आई टॉक टू at least a dozen pharmacists and non-pharmacists as well, business people who own their own medical store, I won't call them pharmacy, and ask them what is their main what is the most common form of drug abuse that they encounter themselves and which is the reality. तो उसमें से मैंने आपको कुछ क्रेजी एग्जांपल्स दी और कुछ ऐसी नॉट सो क्रेजीज दी. ठीक है, तो दैट इज व्हाई दैट वाज इन माय एक्नॉलेजमेंट सेक्शन. तो ओवरऑल picture is not very gloomy, I concluded we need to be able to face reality. Second, if reality is very much harsh, घर की condition ही ऐसी है, तो you have institutes, not for profit institutes, who can counsel you and replace your happy feeling. ये जो पूरा circuit मैंने दिखाया ना, amygdala, hippocampus, nucleus accumbens, prefrontal cortex, engage in some other activity that can fulfill you. ठीक है? So with this, I conclude my presentation. And if you have any questions, so I can answer those questions, hopefully. So I will request the moderators to please step in and they can forward me your questions.
Dr. Jamshed Arsalan, you just nailed it, and I am getting so many messages right now regarding this topic, and the way you explained it, the way you made a concept about drug abuse, what amazing, sir. Thank you so much, and thank you so much all the participants for sharing this much interest in this topic, and this is really overwhelming. Now, participants, you can ask your questions in the comment box, and doctor will answer you. Thank you.
Okay, so a question I got that how to stop a person from doing methamphetamine crystals. So I would like to quote कि in such cases, stop it with your hand. ठीक है? Or say something about it. Or consider it bad. लेकिन पर्सन को बुरा नहीं समझे. पर्सन को आपने जज, you can't judge that person. I just showed you. It is built-in mechanism. If you are not addicted to the drug, then tell me, why are you using Facebook too much? Admit it, you are addicted to Facebook. You are addicted to Twitter. You are addicted to YouTube. Don't pretend that you are not addicted to it, right? Because we are built for that. So understand human psychology. What your job is, get addicted to good stuff. Get addicted to gym, right? The only option that you have is a replacement of one feeling with the other. Just. You can only do that. Otherwise, even a majority of our life is not in our control. Even the thoughts that spontaneously arise in your brain, they are not in your control. Abhi बैठे बैठे, some people might be thinking of tomato. अब ये टोमेटो की थॉट्स कहां से आई? और बैठे बैठे किसी के जहन में आया इलॉन मस्क. You didn't expect that, but it emerged in your brain automatically, right? You didn't think of that. अब जैसे आप लोग लैपटॉप पे बैठे हैं, तो देयर इज समथिंग गोइंग ऑन जो कि आपके ब्रेन में कोई बैठ के बता रहा है, यार ये लैपटॉप है, यार ये कीबोर्ड्स हैं. हु आर यू टॉकिंग टू? हु आर यू टॉकिंग टू? एंड ब्रेन स्टडीज की गई जिसमें यह देखा गया कि एक बंदा डिसीजन कैसे मेक करता है. तो जब वायर्स लगाई गई ना, डिटेक्ट किया गया, तो डिसीजन इज मेड a few seconds, I believe a few microseconds before you know that you have made that decision. Before you know that you have made your decision, your brain makes the decision. So this is not in your control. Stop judging drug addicts, right? Stop judging them, right? So अगर आपने सिर्फ यही मेरी तकरीर सुन ली हो तो ये काफी है. अगर आज की प्रेजेंटेशन के बाद आप ये समझे, we are all drug abusers, at least potentially. We are all prone to addiction, one form of the other. And what we can do? Replace one addiction with the other. This is the only option. ठीक है? और बाकी मैंने आपको बता दिया कि गवर्नमेंटल लेवल पे जो सक्सेसफुल गवर्नमेंट्स हैं वहां पे फुल प्रोग्राम्स हैं. ठीक है? गवर्नमेंट पे आप ज्यादा रिलाई नहीं कर सकते. खुद आप क्या कर सकते हैं? हॉस्पिटल सेटिंग, कॉल द गार्ड्स आगे. अच्छा, हॉस्पिटल सेटिंग नहीं है, कम्युनिटी फार्मेसी. कम्युनिटी फार्मेसी वहां के तो लोग आपको जानते हैं, वो तो आपके अब्बू को शिकायत कर देंगे कि बच्चे के पास में गया था उसने दिया नहीं है. तो ट्राई टू अंडरस्टैंड, उनको थोड़ा बहुत काउंसल करें. उनको ये कहें कि इफ दे कम फॉर 20 टैबलेट्स 4 से काम चलाएं, ताकि उनको रेजिस्टेंस थोड़ी सी फील हो. ठीक है? और बाकी आप बहुत कुछ when you are actually in the field, you will learn a lot. ठीक है, और मुझे आप लोगों के राइट आंसर्स भी मिल गए. यस, आई वाज टॉकिंग अबाउट क्यूरीन आई ड्रॉप्स. आई आस्क यू अ क्वेश्चन एंड योर आंसर इज राइट. Okay, let me move on to other questions. Okay, what properties in drugs usually make people addict? Okay, तो जो एडिक्शन की सर्किटरी दैट आई शोड यू, इसमें एमेगडेला था. एमेगडेला इमोशंस, और एमेगडेला एंड हिपोकैम्पस आपस में बात करेंगे. वो कहेंगे यार याद रखना ये बात, बड़ा मजा आया था. एक ये फैक्टर है इमोशंस, इमोशनल सर्किट को. और वो कैसे एक्टिवेट हो सकता है? यार इसको देखो यार, ये सिगरेट सिगरेट भी नहीं पी रहा, और यार एक कश लगाने से कुछ नहीं होता, और यार ये चीज ट्राई की है, ये बड़े मजे की है. पीयर प्रेशर, बिकॉज वी आर सोशल एनिमल्स, राइट? आप कहें भाई आपकी बायोलॉजी में यू हैव कंट्रोल्ड इट, यू हैव अदर एडिक्शंस. मैं जिम जाता हूं, मैं उसका एडिक्ट हूं, और एडिक्शंस मुझे इतना अपील नहीं करती. फाइन, बायोलॉजी आपकी कहां जाएगी, एडिक्शन की बायोलॉजी. फाइन, यू हैव रिप्लेस्ड इट. सेकंड, साइकोलॉजिकल एनवायरनमेंट का भी तो फैक्टर है ना. इफ यू डोंट फील फुलफिल्ड, अगर आपको तारीफ सुननी है, which becomes your habit, if you are habitual Facebook user, you need some accolades. कोई तारीफ करेगा तो then you feel fulfilled कि हाँ यार मेरी औकात तब है जब मेरी पोस्ट को 50 लोग लाइक करें. अगर मेरी पोस्ट को एक बंदे ने भी लाइक नहीं किया ना, आई एम वर्थलेस. तो अगर आपकी तो ये आदत है ना, तो साइकोलॉजिकली पीयर प्रेशर की वजह से आप ड्रग एडिक्शन और अब्यूज की तरफ जाएंगे. ठीक है, अच्छा वो तो इलीगल सब्सटेंसेस थे. बाकी कैसे करें? बाकी ये जो स्वीट फीलिंग आती है, स्वीट फीलिंग कि ये सिरप पिया था यार बहुत मजा आया था, हाइड्रोलिन डीएम को डिफरेंट ड्रिंक्स में डाला था, तो जो एक्सिपिएंट्स डले हुए थे, जो उसमें एक्टिव इंग्रेडिएंट के भी इफेक्ट्स हैं, लेकिन जो बाद के इफेक्ट्स हैं, जो फ्लेवर्स डले हुए हैं, आहा उसका बड़ा है. तो उसका इलाज रिप्लेसमेंट है, और हेल्दी एक्टिविटीज को ज्वाइन करना है कि आप ना कर सकें. ठीक है, तो अभी भी मैं यही कहूंगा, रिप्लेस करें. रोकना बहुत मुश्किल होता है, रिप्लेस करें अच्छी फीलिंग के साथ. ठीक है, अच्छा ये एक फॉर्म है, ये फॉर्म काइंडली आप फिल कर लीजिएगा. ये फॉर्म हेल्प करेगा एनसीपीपी को फ्यूचर वेबिनार्स अरेंज करने में. ठीक है, इसी तरह एक क्वेश्चन, एक आई बिलीव कमेंट है कि रेड बुल कंटेन्स मोर कैफीन एंड शुगर देन स्टिंग. हाँ, तो रेड बुल की एड आप देखें ना, तो इफ यू नीड फुलफिलमेंट, कि कोई आपको कहे, आपको मीडिया बताए, आपको एडवर्टाइजमेंट बताए कि यू फील गुड, इफ यू आर नॉट फुलफिल्ड देन डेफिनेटली यू आर प्रोन टू इट. तो इसीलिए फाइंड सम एक्टिविटी दैट मेक्स यू फुलफिल्ड. बहुत से लोग प्रेयर्स में ढूंढते हैं कि आपने गॉड से कनेक्ट कर लिया, ठीक है, आप फुलफिल्ड हो गए, यू डोंट नीड एनीवन एल्स. ठीक है, कुछ लोग इसको ज्यादा बुक्स पढ़ने में, रीडिंग करने में, या अच्छे लोगों की कंपनी में, ठीक है, तो उसमें करते हैं. तो यू हैव ऑप्शन ऑफ रिप्लेसिंग द फीलिंग. डज पॉलीफार्मेसी प्लेज अ रोल इन ड्रग मिसयूज एंड अब्यूज? ऑफ कोर्स, इट इज वेरी कॉमन हियर. यस, ये तो पॉलीफार्मेसी तो एक अलहदा ही कैटेगरी है कि बहुत सारी में, जैसे कि इन वन ऑफ द स्लाइड्स आई मेंशन कॉम्बिनेशन ऑफ ओटीसीज. तो समटाइम्स जो रिसर्च होती है किसी भी ड्रग की, वो लाजमी नहीं है कि कॉम्बिनेशन को स्टडी किया गया हो. तो फार्मासिस्ट को कुछ रेड फ्लैग्स होते हैं, कुछ कॉकटेल्स होते हैं जो कि ड्रग एडिक्ट्स बना लेते हैं. मसल रिलैक्सेंट मिला लिया, उसको फलानी दवाई के साथ मिला लिया, उसको एक और चीज के साथ मिला लिया, तो उन्होंने अपने कॉकटेल्स डेवलप किए होते हैं फीलिंग, हाई फीलिंग के लिए. तो वो फार्मासिस्ट जो है जिस सिनेरियो में रहेगा उसको उसका पता होगा. जो कम्युनिटी फार्मासिस्ट सिंध का होगा उसको सिंध की कुछ चीजें पता होंगी. अब जैसे मैंने आपको वोल्टारेल एमोल्जल बताई थी, ये बेसिकली सऊदिया के एक फार्मासिस्ट ने मुझे बताया वहां पे ये यूज होता है. ठीक है, पाकिस्तान में ये बड़ा आपको लगेगा कि अच्छा यहाँ पे तो मैंने नहीं देखा. तो हर जगह की अपनी एडिक्शन और अब्यूज है, और एक फार्मासिस्ट को अपने आसपास का पता होना चाहिए. हाउ वी कैन हेल्प, तो उसके लिए मैंने ड्रग एडिक्शन की हेल्प के लिए मैंने आपको एग्जांपल्स दी कि कुछ जो है इदारे ऐसे हैं जो अपनी बेसिस पे कर रहे हैं. सेकंड, मैंने आपको बताया कि बीइंग अ फार्मासिस्ट यू कैन रिजेक्ट फिलिंग द प्रिस्क्रिप्शन, या अगर आप पे प्रेशर बहुत ज्यादा है, रियलिटीज ऑफ लाइफ है. देखिए मैं आइडियल बात कर दूं, ओ जी रोक दो, ओ जी ये कर दो, लेकिन यहाँ पे आपको पता है बदमाश भी बहुत लोग होते हैं, और ड्रग एडिक्शन इन चीजों में बदमाश लोग बहुत होते हैं। तो यू वांट टू सेव योर लाइफ, तो फिर उस सिलसिले में आप कम कर देना, रेजिस्ट करें थोड़ा सा। बंदा फिलिंग द प्रिस्क्रिप्शन के लिए आया है, आइडियली रिजेक्ट हिम। इफ यू कांट रिजेक्ट हिम, अच्छा थोड़ा सा रुके, अच्छा वो पता है ना यार, एक मिनट रुको, अच्छा ये तो हमारे पास यार 10 टैबलेट्स तो है ही नहीं, और यार गए थे ना, वो फार्मासिस्ट आया था, ड्रग इंस्पेक्टर आया था, उनको तो हमने दिखाना होता है। तो ये आपके पास कुछ टैक्टिक्स हैं। रियलिटी ऑफ लाइफ विल टीच यू अ लॉट ऑफ स्टफ। अच्छा, इसमें डॉक्टर्स का क्या रोल है? तो अच्छा, डॉक्टर्स जो हैं, पाकिस्तान में डॉक्टर्स का बहुत ज्यादा रोल है। डॉक्टर्स भी इस तरह के साइंस थे ना, कि ये बंदा आया है, दर्द के लिए आया था, इसको मैंने इतनी ड्रग दी थी, तो रिकॉर्ड होना चाहिए। तो रिकॉर्ड कीपिंग जब होगी, जिस तरह फॉर एग्जांपल एमआर नंबर, आप AQU जाएं, मुझे तो AQU का एक्सपीरियंस है, आगा खान यूनिवर्सिटी का, वहां आप जाएं तो एमआर नंबर से डाटा आ जाएगा, आपकी प्रिस्क्रिप्शन आ जाएगी कि भाई इसको ये चीजें दी है। तो इस तरह डाटा होना चाहिए। लेकिन सॉरी टू से, दवागो में मैंने देखा उनका डाटा एंट्री है, आई वॉज वेरी प्लीज टू सी दैट। लेकिन गांव देहात में मैंने खुद भी देखा, और वहां के फार्मासिस्ट भी आपको बताएंगे, या फार्मासिस्ट या कंपाउंडर आप कह लें, वो भी आपको बताएंगे कि वहां पे क्या चक्कर होता है। वहां पे सब कुछ पेपर पे चलता है, एक सफ़े पे लिख लिया और बस वही चल गया। तो जो एंट्री है वो इलेक्ट्रॉनिक एंट्री शुड बी मस्ट। इसी तरह ये जो कैश बेस्ड सिस्टम चलता है, वाई बिजनेसमैन प्रेफर कैश, उसका कोई रिकॉर्ड में ही नहीं है, तो कोई टैक्स ही कलेक्ट नहीं होगा। ये भी बहुत ज्यादा है, और उसमें ऐसे ऐसे लोग इन्वॉल्व है ना कि आप हैरान हो जाएंगे, उनका मैं नाम भी नहीं ले सकता, ऐसे लोग इन्वॉल्व होते हैं। अच्छा, एक फार्मासिस्ट ने अपना बताया कि वंस आई रिफ्यूज टू गिव एल्प्राजोलैम, बट कस्टमर कॉल्ड ओनर ऑफ फार्मेसी, यानी बिजनेसमैन को कॉल कर दी, एंड देन ओनर सेड मी टू गिव हिम। सर वी शुड हैव स्ट्रॉन्ग एक्शन ऑन ड्रग लॉज एंड रेगुलेशंस। तो देखिए बेटा, कोई तो वजह है ना कि पाकिस्तान पाकिस्तान है, कोई तो वजह है ना कि करप्शन जहां पे स्टार्ट होती है, पाकिस्तान का नाम आपको टॉप 10 में ही मिल जाएगा। कोई तो वजह है ना कि आपकी इन्फ्लेशन रेट बढ़ता ही बढ़ता चला जा रहा है, हालांकि आपके पास नंबर 1 सब कुछ है। कोई तो वजह है ना, कोई तो वजह है ना कि आपका आम आदमी, उसके घर में चोरी हो जाए। ये मैं आपको पर्सनल स्टोरी बता रहा हूं, एक अपने जानने वाले की, उनके घर चोरी हुई, और मैंने ये कहा कि डॉक्टर के पास, मैंने गलती से कह दिया, उन्होंने मुझे लेक्चर दिया। ठीक है, तो ये तो रियलिटीज है। ठीक है, यहां पे छोटे से क्लर्क को भी, मुस्तनसर हुसैन तारड़ ने कहा था, एक छोटे से क्लर्क को भी आप अगर थोड़ा सा इख्तियार दे देना, वो खुदा बन जाता है। हालांकि सबसे ज्यादा हम अल्ट्रा रिलीजियस कौम हैं, उस पे हमारा ये हाल है, आप ये अंदाजा करें। तो बेटा आप कुछ भी नहीं कर सकते। तो रियलिटीज यही है, मैं आपको रियलिटी बता रहा हूं। हालांकि ये रिकॉर्डेड सेशन है, लोग आइडियल बात सुनना चाहते हैं, सच नहीं बोलो, लेकिन सच यही है, आपको बिजनेसमैन मजबूर करेगा, वो और मजबूर होगा, आप नहीं देंगे तो कोई और बेच देगा, तो उसको पागल कुत्ते ने काटा कि वो प्रॉफिट अपना जाने दे। ठीक है, तो ये भी है। तो अच्छा सिस्टम वो होता है, जिस तरह फ्री मार्केट इकोनॉमी है, अच्छा सिस्टम वो होता है जिसमें बुरे लोगों को भी अच्छा काम करना पड़े। ठीक है, अब मैं एक छोटी सी एग्जांपल दूंगा, कुछ लोगों को बुरी लगेगी, बट लेट मी गिव दैट एग्जांपल। कोरोना वायरस से पहले डोनाल्ड ट्रंप प्रेसिडेंट था, पागल है जी, फलाना है ढमकाना है, लेकिन उसने अनएम्प्लॉयमेंट को 50 years लो पे लेके आया। पिछले 50 सालों में इतनी लो नहीं थी जितना वो लेके आया था। वाई? बिकॉज ऑफ फ्री मार्केट इकोनॉमी। तो अच्छा सिस्टम ऐसा डेवलप हो कि जिसमें बुरे लोगों को भी अच्छा काम करना पड़ जाए, वो मजबूर हो, क्योंकि सिस्टम ऐसा है। ठीक है, तो सिस्टम ऐसा डेवलप होना चाहिए। जब कैमरास हर जगह लगे होंगे तो आप ट्रैफिक को ब्रेक करेंगे तो कैमरा कैच कर लेगा। अब आप पुलिस वाले को क्या पैसे देंगे? पुलिस वाले को तो चालान करना पड़ेगा, क्योंकि कैमरा ने ऑलरेडी रिकॉर्ड कर दिया ये नंबर प्लेट है, और पीछे से डाटा में आया ही नहीं है इस नंबर प्लेट का कोई चालान। ठीक है, तो ये जस्ट एग्जांपल्स हैं। और ऑलवेज अवॉइड रेवोल्यूशन, ऑलवेज अवॉइड रेवोल्यूशन, क्योंकि रेवोल्यूशन में, इनकलाब में, मिडिल क्लास और जो लोअर तबका उसका बेड़ा गर्क होता है। हमेशा एवोल्यूशन, आप सही होंगे ना तो बाकी आहिस्ता आहिस्ता सही होगा। ठीक है, और आपको भी सेंट बनने का किसी ने कहा, आप एक हद तक ही अच्छा काम करें और कंसिस्टेंट रहें। कई लोगों को देखा बहुत अच्छे होते हैं। आई वोंट टेक मच लॉन्ग, 5 मिनट्स में हम सेशन क्लोज करेंगे। आप एक फॉर्म है जो कि आप साइन कर लीजिएगा काइंडली, मॉडरेटर्स वो फॉर्म आप तक शेयर कर देंगे, वो फॉर्म काइंडली साइन कीजिएगा। आई विल जस्ट टेक 5 मिनट्स। मैंने कई ऐसे लोगों को देखा जो बहुत प्योर थे, बहुत सेंट तबका था, सेंट लेवल था उनका, बहुत अच्छे, लेकिन जब उनको करप्शन की चोटें लगती गई ना, फिर वो इतने करप्ट हो गए कि अब वो सिनिकल हो गए। अब वो करप्शन को खुद प्रमोट करते हैं कि यार हमारे साथ भी तो हुआ था, तो खुदारा ऐसा नहीं बन जाए। ठीक है, आपको रियलिटीज का पता हो। सेंट बनने का आपको किसी ने नहीं कहा, जिस हद तक आपकी कैपेसिटी हो आप उस हद तक करें। उसका फायदा यह होगा कि मरते दम तक आप सिनिकल नहीं होंगे। अब ये नहीं कहेंगे यार होता ही यही है, यार यार होता ही यही है, नहीं, क्योंकि आपने खुद अपनी लाइफ ऐसी गुजारी होगी। अभी तो आप आगे जाके देखिएगा आपको कितना जॉब में काटा जाता है, जस्ट बिकॉज कि आप ये काम नहीं करते। लेकिन यह है कि आपने अपने तौर पे सेल्फ सेटिस्फेक्शन, इनवर्ड एनालिसिस कीजिए, और सेंट नहीं बनना। ओके, अच्छा, ये बहुत जबरदस्त क्वेश्चन है कि कैन आई गेट एडिक्ट अगर मैंने एक दफा ड्रग ले ली, एक दफा ड्रग ले ली। तो रिमेंबर, यू डोंट कंट्रोल योर ब्रेन। ठीक है, तो ब्रेन में जो चल रहा है ना, तो ब्रेन तो आपका उस चीज को रिकॉर्ड करेगा। अमेगडाला हिपोकैम्पस से बात करेगा, वो कहेगा यस, रिकॉर्ड दिस, इसको याद रखो। न्यूक्लियस अकम्बल से कहेगा हाँ यार इस काम के लिए जाओ, एग्जीक्यूटिव डिसीजन मेकअप होगा कि हाँ यार फार्मेसी में जाओ, वहां से उठा लो। तो इसीलिए अवॉइड इवन वंस। ठीक है, तो जैसे इफ यू थिंक यू आर एन एडिक्ट, जैसे मैं एडिक्ट हूं किस चीज का, फॉर एग्जाम्पल भाई व्हाट्सएप में जो स्टेटस की फील्ड होती है ना, उस पर एक छोटा सा निशान बना हुआ आता है कि ये स्टेटस आपने देखा नहीं है। तो कुछ लोग इंक्लूडिंग माई सेल्फ, आई हैव टू क्लिक, आई हैव टू सी द स्टेटस। If I recognize this addiction potential in myself, then I should also realize that Facebook will be killer for me. Facebook तो मुझे पता नहीं मेरा दिन रात इसमें गुजर जाएंगी। I won't be available for my family. I won't be available for any other form of activity. ठीक है, तो चलो आज की इस तकरीर को यहीं पे एंड करते हैं। थैंक यू फॉर योर क्वेश्चंस एंड थैंक यू फॉर योर अमेजिंग कमेंट्स। एंड अगेन आई वुड लाइक टू एक्नॉलेज ऑल द फार्मासिस्ट जो कि मेरी स्लाइड में थे, जिन्होंने मेरी हेल्प की, एंड नॉन फार्मासिस्ट एज वेल, एंड मोस्ट ऑफ ऑल एनसीपीपी का, कि जिन्होंने मुझे मुझे कांटेक्ट किया और मुझे इस बात पे एग्री किया। और आई रियलाइज कि ये चीज़ें हमारे माशरे में स्प्रेड होनी चाहिए, क्योंकि किसी भी चीज़ को ठीक करने का, मेरी स्लाइड में भी जो व्हाट वी कैन डू से पहले था साइंस, के पहले आप देखें तो सही कि क्या चीज़ें हैं। ठीक है, थैंक यू सो मच। तो अभी मैं रिकॉर्डिंग इसकी एंड करता हूँ, एंड थैंक यू सो मच फॉर योर पार्टिसिपेशन।
Again,